Bernadette Baligod. So today I'm going to perform the heart vascular assessment. So first is we will going to introduce yourself and verify the client's identity. Explain to the client what are you going to do, why this is necessary, and how the clients can cooperate. So hi, I'm Bernadette Baligod, the student nurse from Tarlac State University. So may I know your name? Okay, Mr. Antonio Bautista. Today I'm going to check your chest to locate if they have an abnormalities. So next is we will go. This is to help to alleviate the anxiety, promote cooperation, and facilitate examination. The patient's identity ensure that the assessment that we will going to perform is into the right patient. So next is we will going to uh, perform hand hygiene and observe other appropriate infection control procedure. So we're going to use an alcohol. This is to prevent the spreading of microorganisms. Then provide the patient's privacy by closing the doors and the curtains. So next is we're going to determine the patient's history. So first is the chest pain, the pulsation, the dyspnea, the orthopnea, and the fatigue, and the cardiac history, and also the edema, then the family cardiac history, and the last is the past medical history. So we will going to the inspection. So inspect chest to identify the landmark that aid uh, into the assessment of the heart. So chest for the visibility of the point into the maximum impulse and any abnormal pulsation. So this is the small apical pulse at the medial to the left mid-clavicular at the fourth and fifth intercostal space. It may not be visible into the patient's has a large chest. So next, so we're going to inspect. So first is the intercostal space. So the intercostal space is into the here. So it is located into the space between the line of the chest. So here. So it is located by the finding the sternal angle. So the sternal angle, and then which felt at the ridge in the sternal uh, approximately um, 2 inches, approximately 2 inches into the sternal notch. So the adjacent into the rib, so into the ribs, it is into the spaces between the ribs. So the adjacent to the rib is into the second rib and the second intercostal space. So two so the other intercostal space can identify by counting uh, the from the second intercostal space to the to the fifth intercostal at the junction of the sternum and the xiphoid process. So next is we will go to inspect also the mid-sternal line. So the mid-sternal line, so imaginary line extending down to the middle of the sternum. So it divides the anterior chest into the half. So the mid-sternal, so it is into the middle. So here the middle. And then next is we will going to we'll going into the mid-clavicular line. So in mid-clavicular line is into the imaginary line extending from the middle of the clavicle down to the chest. So here it is the middle of it is the mid-clavicular. It is into the middle of the So it is dividing the left and right um, anterior chest into the two parts. So next is we will going to um, we're going to do the palpation. So the client should be into the lying down, palpate using the fingertips, um, fingertips and the palmar surface. So uh, the position uh, into the beginning of the aortic area and the moving down the um, this, moving down the chest uh, into the second tricuspid areas. So we will going to palpate the patient should be with our fingertips. So into the aortic area. So there is no vibration or pulsation. One palpated the aortic, pulmonic, and the tricuspid. So first is we will going to the aortic. So in aortic area, palpate the second intercostal space. So uh, the second intercostal space at the right sternal border. So there are in the second intercostal space at the it is into the right. So here and then the pulmonic area. So the pulmonic area, so palpate second intercostal space at the sternal border. So we're going to palpate the second intercostal. So second intercostal. So after that is the Erb's point. So palpate the third intercostal, the left sternal border. So here the third here we're going to palpate. And then the tricuspid area. So it is into the fifth intercostal, lower left sternal border. Here. It is into the fifth. And then we will going into the we're going to the mitral we're going to mitral area. So palpate the fifth intercostal at the left uh, mid-clavicular line. So this is also called the we call this the PMI. So we're going to palpate the fifth intercostal at the left. So here, so the fifth. So the PMI is into the left as the pulsation and is the approximately the size of uh, an at the size of the nickel may not be palpated into the large chest. So next is the auscultation. Move the across and then um, down the chest with the clients in the supine position. So if the patient is supine position, when have the client lean forward and then exhale while you listen over the aortic area with the diaphragm. So we're going to use, of course, the stethoscope for the auscultation. Okay, sir. Just Okay, sir. Just uh, breath. Okay, exhale. Okay. After that, after that is ask the patient to breathe comfortable, in a comfortable. So then hold the breath in in expiration. So also take the to identify the first heart sound. So which is the S1. So it should be love. It should be the sound love. When the diaphragm at the apex, fifth intercostal space. So we're going to the fifth intercostal space. It is into the so okay, just breath. Okay, it may become softer with the inspiration split as S1 is normal into the children, young adults, and pregnant women. So next is uh, we will going to auscultate the S1 with the bell of the stethoscope. So it is a low. So auscultate the S1. So okay, it is a low, faint sound occurring at the beginning of the diastolic uh, diastolic pulse as we auscultated into the children and to the young adults, but disappears upon standing or sitting up. So the cardiac into the people with the high cardiac output and to the woman in the third trimester of the pregnancy. So next is we will going to auscultate the S4. So the S4 it is a soft, low, uh, low pitch sound heard best with the client uh, into the supine or to the left lateral position with the stethoscope bell. So we're going to the S4 into the documentation. So it is a basis reflection into the nursing assessment, the changes into the clinical state, and also into the patient pertinent information. So that's all for the heart vascular assessment.